journalists with the Southern Africa Accountability Journalism Project in collaboration with the Henry Nxumalo Foundation. Dalphine Tagwireyi, a very good evening to you. Thank you so much for joining us and welcome.
Good evening, Mpho. Thank you so much for having me.
I mean, Dalphine, this is an investigation that has left a lot of people shocked. What first raised suspicions that ARVs were being used in chicken feed?
Oh, I think it's worth noting that it was first flagged by the National AIDS Council of Zimbabwe. That was way back in 2015, where they were warning poultry farmers to stop using ARVs to feed their broiler chickens in a bid to boost growth. So this is like a 11-year-old issue. And what the investigative team really, our investigative team first became aware, of reports during a broader look at antimicrobial resistance in agriculture in the region. So we saw a gap because there were a lot of reports, a lot of articles that were coming out. So what we sought to do, like with the help of, and I'm really thankful for the Henry Nxumalo Foundation because they saw that we needed to dig deep to ensure we would actually bring this to light because we want to know what has been done in the past 11 years because authorities in Zimbabwe were the first ones to flag this out.
So how widespread does your investigation suggest this practice is? Are we talking about isolated cases over that 11-year period, or is it something far more systemic?
So when you look at reports and articles that have been published during the 11-year period, you'd actually find that this has been happening in different sections of the country, that is different provinces. When the National AIDS Council first blew a whistle on it, that was in Matabeleland North, the north side of the country. Our investigation was focusing on Harare, the capital city. And with the agricultural extension officer that we spoke to, he did mention that in a couple of provinces in the country, like most of poultry farmers are misinformed. And what farmer A does, if it works for him, he passes on the information. So like there's a lot of misinformation that is going around and it needs to be killed.
So in terms of the evidence, what did you uncover that links poultry farmers to the use of ARVs in chicken feed as you went in to really get to the bottom of a lot of these allegations that have been surfacing over the past decade?
Okay, so this investigation took us over a period of 3 months. I'll tell you that we went into the trenches and we did various visits to the source that we spoke to that eventually then opened up to us. We saw the whole process of her grinding ARV pills and then mixing them with chicken feed. And as she does that, right,
yes.
This is a farmer who knows that what she's doing is illegal. So she keeps her own coop where she ensures her family and herself only consume the poultry that is not tainted because she understands that there is antimicrobial resistance. So she would rather not expose her children, she would rather not expose herself, she would rather make a quick buck.
Sure. I mean, that's really frightening. What does this practice mean for Zimbabwe's HIV/AIDS program, particularly in terms now of drug supply and access for patients, because it's been used in places where it shouldn't be used?
Honestly, I think it really sets us back. According to, official reports as well as articles that are out there. Why? Because the diversion of ARVs, from people that really need them, you would actually find that there are HIV positive patients that are not on treatment. So it means the diversion of the ARVs into the black market means they will not have access to the drugs because they need them. yet a corrupt official actually finds it better for him, to divert the drugs and ensure that he feeds the black market. I think really with the fight that Zimbabwe has done the past 20 years in curbing HIV and AIDS, I feel like this would really, 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 take us back, because now we are facing a public health crisis. The World Health Organization calls antimicrobial resistance a crisis. I mean, in 2019, they said 1.2 million deaths were actually experienced in sub-Saharan Africa as well as Southeast Asia. So this is a crisis that's waiting to happen, and we need to be able to curb it in the bud.
Yes, I mean, you raised an important point there. One of the biggest concerns, of course, is public health, especially as you talk about having interacted with a farmer who was willing and conscious to separate the chicken so that her family is not exposed to the drugs. What are experts saying about the potential risks to consumers if chickens have been exposed to the drugs?
Mm-hmm. So what experts are saying really is that for HIV positive patients, right, it means that antiretroviral treatment will not work for them. And then for patients that are not HIV positive, since most of the broiler chickens are either fed with ARVs or antibiotics, it means antibiotics will not be working. So the experts also mentioned that infections that were once treated could actually become harder to treat, and people can actually die from simple infections.
And very quickly, before we wrap the conversation up, have authorities responded to your findings? Is there any action been taken in the interim with this revelation?
Yes, they have responded. We are still in communication, and I'm sure whatever response that they have will be in our next follow-up investigation story.
Very well. Thank you so much for speaking to us. Some shocking revelations there with the investigative journalist with the Southern Africa Accountability Journalism Project, Dalphine Tagwireyi, giving us the information, having collaborated with the Henry Nxumalo Foundation, a disturbing investigation when it comes to some chicken farmers in Zimbabwe allegedly using ARVs in poultry feed to boost growth and prevent disease. Really, really shocking.